Professor Uparatana Thero is a prominent scholar with a remarkable academic background, and he completed his BA degree in Pali with first-class honors from the University of Kelaniya in Sri Lanka. He holds additional master's degree in Sinhala and English from same university and achieved a Master's of Buddhist Studies from the University of Hong Kong. His academic journey was further distinguished by the PhD from Wuhan University, China. In addition to his degrees, Venerable Professor Uparatana Thero has pursued language certifications, including diploma in English and Chinese, enhancing his expertise and cross-cultural understanding. Throughout his career, Venerable Professor Uparatana Thero has made significant contributions to the field of Buddhist studies. He has authored several books and 10 full papers and presented 17 abstracts at various national and international conferences addressing topics ranging from Pali language studies to Buddhist meditation and his contemporary applications. Currently, he serves as the Dean of the Faculty of Postgraduate Institute at Buddhist and Pali University of Sri Lanka, and is an active member of numerous university committees. His leadership and extensive academic experience make him exceptionally well-studied chair for this session. Please join me extending a warm welcome to Venerable Professor Morogallagana Uparatana Thero. So I would like to invite the session chair, Venerable Professor Morogallagana Uparatana Thero, to continue the session here.
Thank you very much. The co-chair, Lecturer Mr. K.A.R.S. Kaluarati, for introducing me. Thank you very much again, and good morning to all of you. Now we are starting the plenary session of this international conference. We have already left 40 minutes of this plenary session. Therefore, we have to finish this session 11:30, but we try to at least to finish this presentation and this session 11:45. So in this session there are 3 presenters. The one presentation in Pali, and there are 2 other presentations in English. So each presenter is given 10 minutes for the presentation. At the end of the 8 minutes of the presentation, we ring the bell for 1 time, and at the end of the 10 minutes, we ring the bell 2 times. Okay, so then you have to finish your presentation. At the end of the all presentations, we open to all question and answer session. Therefore, without taking much time, I would like to invite our first presenter, Venerable Sundara Lankara Thera, his presentation in Pali Bahasaya. After his presentation, you can ask any questions. Pali Bahasaya wa Anglika Bahasaya wa Amahakan Thero Panya Putya Visajetum Sakha Pali Bahasaya wa Anglika Bahasaya. English and Pali, you can ask any questions. He will be able enough to answer all the questions. So now, available time to you for your presentation.
Subhumano Matira Jiwa Ubasaka Ubasika Yoja Umasame Sandipate Samagadana Samagana Domaga Indata Sabina and Tiria Borati Sundrana Garonama Buruma Ratado Agadomi, Idana Pida Denia, Ma Nikila Ujale Banya Oganami, Idani Maya Palia Likit and Bana Pasesami, Mama Banasa Nama Bana Sudanda Bidagi Agadana, Seka Bana, Libresana, Wesana, Imambana Panjai Kandehi Pasesami. Panjai Kandehi Pasesami, Patama Nidana, the Dobada, Lisana Panyani, the Dobada, Urida Trita Sobuchana, the Dobada Sotanda Bidade Agada Sikapana Ubrisa, Dabada Nikamana Pasesami, Irani Nidana Pasesami, Amaga Bagawa, Panja Jadani Sawasandi, Buddhisaya, Ajasaya, Janisawa, Uride, Udesi, Sekapisi. Jarada Bigaway, Jadigan, Deseda Tama Adina Nabi, Savagija, Jadigan Jarapetawa, Uvide, Udesi, Seka Besi, Waja Besi. The Budana, Segabana, Lubreza, the Rajana Agarina, Sotu Janana, Luruba, the Tatina Agarina, Uba Yogo Kataboyua, and Resana Kataboyua. Imanibana. Mama Nusana Pande, Wesachi Dani, Nusana Panyani. Imezu Bachi Ma Biwa, Idani, Pasesami, Idani Bana, Pamani Go, Alota Sama, Brigona, Basido, Asakuniata. Ajali, Sotu Janana, Wivida Chita Pao, Jani Depo. Sotu Janai, Ikaji, Ika Panya, Ikaji Pana, Manda Panya. Dasama, immediate Bogala, Ajari, Jani Deva. But a more Bogolo Pana, Wagoja Panyo Bogolo, Ikaji Pana, Sakajan, Dama Nasunadi, Nabisa Gondi, Manasikado. Asana Otrida Kali, Yewa Savani, Pamosani. Say it happy. Wago J. Gombe, Udaga, Ase Jambi, Na Sandari, they were the Bogolo, Wago Jap, Panyo Bogolo, di Chani Dabo, Udio Bogolo, Bana, Ochanga, Panyo Bogolo, Ika Bana, Sakajan, Dama Sunandi, Abija, Nasa Kondi, and Nasika. Asana Otida Kali, Yewa Sabani, Pamosandi, Nasandi. Say it happy. Udisasa Ochange. Tabitani, Nana Kachagani, Asana Otega Gali, Sabani, Agenani, Webeginani Hondi, they were the Bogolo, Uchanga, Pano Bogolodi, Jani Debo. Daddy of Bogolopana, Utu Pano Bogolo, Ika Sagajan Damasunadi, Sagondi Minasikado, Asana Otega Wabi, Napa Mutani, they were the Bogolo, Utu Pano Bogolo. Tabara, Ika Sotu Janapana, Podisania. Tea go, take up by your Hokawabi, Sapa, Baho, Oganido, Nasakunandi. Say Tabi, Tulapanaga Tilovia. Saji saw Ubudi Grani, Oganadi, Tasman Gale, Bobe, Gida, Gida Bradi, Nasati, Numosati. They were the Babogana, Logi, Sandi, Ajari, Chani Daba. Tabana, Ika Jason Janabana, take up Mania, Vidiawa, Tamawa, Hodawabi, Panya, not Lavandi. Kasama, actually, not a Naniasa and a little bado. Said Abi, Vidu was soon Nagarapodo, Timasa, Gamatana, and Luyo Dobi. Take the Gaga Dambi, Nalavi, Kasama, Asamada, Saribo Dana, Gamatanasa, and a little bado. Kasama, Saji, Adana Sexa, Banya Ode, Nalagadi, Adana, Dana, Nayo, Puna, Pachavaki, Japoa. Irani, Sodana Bidagi Agada, Segabana, Yurisa, Basami. Ramo Sakajanayo, Ajali, Sodujani, Sade, Sakaji, Dawa, Sekabi, Daba, Dudionio Pana, Panya, Yagrana, Ikansa, Yagrania, Jadani, Yanya, Yagrana, Jani Dewa, Ajari Ye, Ikaji Sojana, Ikasina, Jagridowa, Ikaji, Ugaja, Jagridowa, Sikabidava, Tadio, Leopana, Nokamanio, Noabana, Nubobi Katawia, Danagata, Silagata Adayo, Nubobi Katawia, Patama, Sutasa, Supagada, Dama, Sikabitawa, Tadobaran, Gambia, Gambino Ato, Sikabitavo. Ewa Mewa Sobu Janana, Nogamina, Nubudi Badia, Sikabitava. So Ronio Bana, Jadaga Wotukarana Neo, Ika Jesobu Janabana, Saje, Saraga Woto, Panani, Dan Suni Dukama on the Oida Soda on the. There are 10 days, Saraga Wotu, Agada, Yoda, Karana Gada, Jane Dewa, the Niweda check the Hodawa, Organization, Pajamonio Bana, Uma de Sonano, Aizama, Nudo, Ewan, Wadi, Ugamaya, Midikaji, when you Purisa, Asitasa, Ata, Ajanadi, Desama, Ikaji Sopujanabana, Ugamaya, Paside, Sukina, Janadi, Desama, Tita, Polanu, Rubawa, Talanu, Rubawa, Ugamayo, Udredoa, Sikabidaba. Charona Yobana, Canana Neo, Dogamaniga Neo, Dibi, Yobudo, Yoda Mewa, Pagawabana, Patana, Sanke Dina, Hoki Dina, Parana, Surubani, Uredoa, the Dogana, Witarado, Dama Adesi, Iwa Mewa, Parana, Surubani, Patana, Wodawa, the Dogana, De Randani, Parana Surubani, Witarado, Sikabidaba. Sadamonio Bana, Gata Salabaneo. So do Janei Sade Saya Bovia, Inyamina, Rasalavan, Gatawabi, Sikabidaba. Atamoneo Bana, Takanugada, Viva Jananeo, Pagawa, Kalama Sodi, Yadumi Kalama, Adanawa, Jani Yaradi, Adano Yani, not Jani do Sikabisi, you are Bewa, so do Janana, Adano Yani, not Uba Brekido, Sana Bedo, Sikabidaba. Nawamoneo Bana. Tiga Samasa Sanayo, Ega is Sojanabana, Chidadika, Widana, Widisu, Banawabana, and Gudi Mala, Padasadario, Satana, Tita, Yadi Jasanadi, the Shamana, Jagan, Samasa Sikawa, Dama Adisi, Iwa Mewa, Sojanana, Widida, Widana, Jani Dowa, Padiga and Gadawa, Sikabidava, the Samoneo Bana, Awenga, Sikabanayo. Wabana Grania Meta Sopia, Ewa Miva, Ewa, Meta Bavana, Awida Badi, Ujuga, Awida Tangadawa, Dama Adesi, Ewa Miva, Sodu Janana Ataya, Ewa Nisi Daba, Ewa Gandava, Arina Yanabi, Ujuga, Awida Tangadawa, Sekawi Daba, Idani Nigamana, Masesami, Saje, Ajari, Ime, Widuba, you would say, Sekabedi. Tasamengali, Sodu Jana, Sukina, Janisani, Akilimatena, Janisani, Adano, Yani Nabi, Ubabri Kido, Great Sani, Ubabri Kisani, the Yamana Data Danigo at all, Idani Ajisana, Kadugamo, Sonana Bidagi, Agadana, Segabana, Yuburizana, Ikajamiwa, Mama Pandi, Wibachida, Dasida, Dasama. Anya Yubudisawa, Anya Bidagay, Agada, Segapana, Yubudisawa, Wibachidawa, Yatabajana, Jaredawa, Imanoga, Dama Dibina, Dama Alogena, Jodi Tadi, Ajisana, Kadukamo, Sabesada, Sukida, Rubagara.
Thank you very much, Venerable, for winding up your presentation on the time. Please come and see Venerable. Okay, after all the presentation finished, we come to the question and answer session. And I invite to our next presenter, Dr. Chandana Abewardana and Dr. Kaluarachige Amila Sampath. Your topic is Girimananda Sutta as an audio-visual therapeutic tool for reducing pain and anxiety of non-communicable diseases. You are also given 10 minutes.
Hi everyone. My topic is Girimanan Sutta as an audiovisual therapeutic tool for reducing pain and anxiety of non-communicable disease. Non-communicable disease is alarming issues in both Eastern and Western countries in the 20th century. Cancer, diabetic and myocardial infarctions, Alzheimer's disease, dementia, issues causing pain and suffering in both Western and Eastern society. But this pathetic situation in Sri Lanka has a opioid analgesics only used for the cancer palliative care, and organ transplant and OLA is really highly expensive. Some doctors even say there is no such things are purely physical disease. Example is dental caries. Sugar consumption is a key factor of the dental caries, but American Dental Society did the research in 1937. There is unsatisfactory children are more prone to the dental caries. So the conclusion is optimistic patient has more chance to get well than a patient who worried and unhappy. Cause main cause is stress. Then they use for the neurological music therapy for associated with the curative treatment as a palliative care for the stroke and Parkinson's disease, cerebral palsy and Alzheimer's disease. Also they use for the proactive and the receptive music therapy for the as a treatment. Sound is a form of energy. It is a media to transmit. When sound stimulate as a vibration in our outer ear, then transmit into middle ear, then it transmit to the brain as electrical pulses through the vestibulocochlear nerve. In Western country, did lot of music therapy as a repetitive blessing sound. In Hindu culture, they did the repetitive Om sounds, and Mahayana tradition, they did Om Manipatre Om, like Prajnaparamita Dharani, used for the reducing stress as an associated treatment. And Muslim, they used Salat, and in Western culture, they used in Santa Claus praise repeatedly for the meditative trance. And Sri Lankan, Professor Chandana Jayaratne and Reverend Madalu Pali Thero did research for associated with the, they exposed the repetitive basics period in 10 minutes. They got a result is for regulation for heart sounds. Pirit, in first we heard Kanda Pirit in Chullavagga in Vinaya Pitaka and Ahimetta Sutra in Anguttara Nikaya. Purpose of reciting of Pirit to protect living being from all disasters, all fears and all pains. Girimana Sutra is special. It has it's a philosophical aspect because it's contained cause of suffering and prevention and method. It's especially we can use for the patients as a therapeutic tool. My research problem is, are there any healing and palliative function of Buddhist rituals in addressing physical and mental health issues using human six senses, especially effect of mindfulness listening to Buddhist spirit, Girimana Sutra especially. Our research objective is to determine the healing and palliative function of Buddhist ritual in healing and promoting physical and mental health issues. Methodology of research, this is a crochet experimental intervention studies and 40 healthy individuals are involved. Pirits, we used is low frequency Pirit sound, 70 to 150 Hertz in 35 minutes. Two times we expose all individuals. Also we simultaneously display the meaning of the Pirit in Sinhala and English subtitle, also relevant pictures. We use narrative focus for these studies because Asian content, we are familiar with the narrations. I use that method because the Girimana Sutra is not just is listening, it is actually a mental and physical we have as a practical sessions, especially. I use for the following tools for the pain relief and reduction of the anxiety, especially mood barometer. I did also I use for the biological parameters, blood pressure, pulse, and respiratory were assessed. We did 3 sessions. This is a result. It's my final conclusion is the little focuses mainly spirit blessing could be identified as a non-invasive and non-pharmacological and low-cost palliative care for healing and therapeutic tools. This also can describe as a by a dialectics. It's a thesis, it's an interaction of the contradictions. We can use the thesis to, and we can interact with the Kusalasa Sampadana, Kusalasa with Papasa, then we can get with mindfulness in breathing and out breathing, and also we can use the mindfulness listening. We can get the we can reduce pain and suffering. Thank you very much.
Thank you very much, Dr. Chandana Abewardana. Our last presenter of this plenary session, Mrs. Ranasinghe Mudyanselage Sadarshi Kusuma Varsha Ranasinghe. Your topic is application of communicative language teachings and interactive approaches to enhance communicative competence in ESL learners. So you are also given 10 minutes. Please wind up your presentation within your time.
Venerable Mahasangha, including Chair, Co-Chair and distinguished scholars of the gathering, are Maramis K. Ranasinghe, presenting on the topic Application of Communicative Language Teaching and Interactive Approaches to Enhance Communicative Competence in Learners who Study English as their second language. I'm sorry, the topic is not visible. And this is the overview of my presentation. And to provide a brief introduction, this research attempts to explore the application of communicative language teaching, which is also known as CLT, an interactive approach in teaching English as a second language to students who represent B1 level of Common European Framework for Languages. So here you can see a cross-section of this framework, and here I will be focusing on level B, independent speaker and specifically B1 intermediate level. So these are the two theories which were experimented in this research. First one, communicative language teaching, which was initiated in 1980s. So the philosophy behind this theory is that in order to learn a language, a learner has to practice using that language to communicate meaning with each other. And then there's interactive approach, which allows the students to actively involve in the learning process to absorb the information and knowledge from their teachers as well as co-learners. Then moving on to the objective, this research aims to explore ways and methods in which the communicative competence of learners could be enhanced via interactive and learner-centered approaches, specifically to enrich vocabulary and also the ability of comprehension of the learners. Then this is my research problem. Can CLT and interactive approaches effectively enhance reading comprehension and vocabulary acquisition in learners who learn English as their second language? Then a literature review was conducted based on these two approaches, and the first research refers to Savignan. So this refers to CLT approach and how students who were exposed to CLT based syllabuses displayed higher fluency and also how they were able to negotiate meaning than the others, the rest who were taught using traditional methods, including grammar translation method and audiolingual method. Due to time constraints, I have only mentioned 2 prior studies, and via this literature review, it was identified that there's a research gap. There's this lack of research on CLT and interactive approaches within this specific context of Sri Lankan English language teaching, and specifically with reference to the selected texts which are taken from the storybook Matilda by Roald Dahl. So moving on to my theoretical framework, this research is based on the socio-cultural theory of language development, and it focuses on the importance of social interaction in language learning. So here it is assumed that language acquisition is not an isolated process but a social process. And also, according to this theory, learners develop linguistic skills through shared experiences as well as interaction. And the teacher acts as a facilitator rather than sole transmitter or the only transmitter of knowledge or language. And also it is assumed that learners co-construct knowledge through interaction with more knowledgeable others. And here more knowledgeable others can be teachers, mentors, or even peers who are more competent than the target group. So moving on to the methodology, this was conducted as an action research, and activities were designed around a passage from Matilda, which was written by Roald Dahl. So the lesson initiated with an icebreaker activity, and the teaching process were divided into 3 main stages, namely pre-reading, while reading, and post-reading stages. And pair work and group work were utilized, and also the lesson was designed to be learner-centered, accommodating a B1 level class of 20 students. And data was collected via observation, student feedback, and also pre and post assessments. Moving on, this was the first activity given in the prior reading stage. So the students were asked to come up with the meanings of these words, and first this was given as an individual activity, and later the responses were recorded, and then it was given as a pair work, the same activity. Then during reading stage, these reading passages were provided, and the students were asked to infer the meanings of these words by referring to these passages. So they were basically asked to infer the meanings by referring to the overall meaning of these passages, and that was done as a group work. After that, moving to the post-reading stage, these comprehension questions were given, and they were given as a pair work. So data was collected via observation of participation levels and interaction with the lesson as well as interaction with each other. And then student feedback was collected at the end of the lesson. And pre and post assessment of reading comprehension and vocabulary acquisition were conducted to gauge improvement of the learners. Then moving to the findings, via observation of participation levels and interaction, it was observed that there's a development and improvement of reading comprehension ability, and also higher confidence levels were observed, and also relaxed reactions were observed when they were involved in this pair work and group work. And with reference to pre and post lesson assessments, when the same vocabulary activity was given as an individual work, and pair work, the latter, which means pair work, showed better results than the former, which means the individual work. And also student feedback catered to 3 different levels: positive, negative, and neutral. So here I have attached one image of. Thank you. So here I have attached one positive feedback, and then according to this graph chart, you can see how positive feedback is comparatively higher than negative and neutral feedback. Then moving to the results, so it is evident that CLT, which means communicative language teaching method, and interactive method do promote higher levels of student participation as well as engagement, and also how interactive approach can assist in increasing ability to comprehend main ideas, key ideas, even when there's unfamiliar vocabulary, and also how this can be assisted in vocabulary enrichment at large. So these are the recommendations of my research to continue using CLT approach in similar contexts, as it is immensely effective in increasing student participation. And also another recommendation would be to focus on interactive contextualized vocabulary at large. So with that we come to the conclusion. So the presentation can be concluded with this remark that both communicative and interactive methods do provide an effective framework for ESL students, specifically with reference to enhancing their vocabulary as well as their ability of reading comprehension. So that would be the end of my presentation. These are my references. Thank you immensely for your time and attention.
Thank you very much, Kusumwar Singha, for wonderful presentation on your time. Now we come to our question and answer session. We already left 50 minutes of this session. Therefore, we have to finish this presentation, this session at 11:45. Therefore, we don't have enough time to ask the questions and give any answers for the questions. Therefore, I would like to open for this audience to ask the one question from the first presenter. Short question. If you have any short question, please ask. Please ask a short question, Venerable. We can hear. Please ask.
My question is related to Dr. Chandana Abdul. And the question is, there's only Vinay Sutta using as audio visual therapeutic tool. What about the other suttas, like Pradita or some kind of other suttas? Have you ever utilized?
Nirvana Sutra is simply can understand all the meditation. So I use for this therapeutic tool for patient. Patient may have idea about the content of the Buddhist philosophy. So I use Nirvana Sutra. It is as content is suffering and cause of suffering and prevention and method of the prevention.
Okay, thank you very much. Venerable, we don't have much time, so I will give a chance for only one person to ask any question from our one of any presenter. Okay, so we can do the chance for only one person.
My question to Dr. Chandana Abdul again. What are the inclusion and exclusion criteria for your study? Because it is an interventional study, so you have show that slide, I think. Because it is a clinical related one. Maybe although you have include all the NCDs which you have selected as 40 patients, anyhow you have to mention the exclusion criteria as well.
I did the cancer patient in my initial studies. Then I did for the drug addiction for my second study. But we have no because we couldn't get the ethical review approval yet. So I did research on it.
Okay, it seems it's ongoing research state.
Sorry? Yeah.
Is it ongoing research?
Yeah.
Okay.
I want to expand after ethical clearance.
Okay, thank you very much. And we have to close this question and answer session because we don't have enough time. And monks also have to go for the lunch. Therefore, in this international conference, the first plenary session, there were 3 presentations, especially one presentation in Pali language, and especially he explained the teaching methods, how to use the teaching methods to make understand the students easily. And our presenter especially explained in the Sutta Pitaka how the Buddha used teaching methods to transfer the doctrine to his disciples. And the second presentation, especially the Girimananda Suttas and audio-visual techniques, especially he discussed in his presentation how to use the chanting spirit to recover some, especially non-communicable diseases. I think he mentioned his research is ongoing research. He is still doing his research, and it is very important one. Explaining about the chanting of the spirit and the result of chanting spirit. And the third presentation, application of communicative language teaching and interactive approach to enhance communicative competence ESL learners. Especially she explained how to use the communicative method to enhance the vocabulary of the students and how to use that. So thank you very much for 3 presenters for your valuable presentations and illuminating us in this international conference of this plenary session. And I would like to hand over the microphone to our co-chair to continue the last.
Thank you. Thank you very much, Venerable Professor Morogallagama Uparatana Thero, the chair of the plenary session. And thanks again for your insight sharing of this plenary session. And anyway, I also have some questions to ask from the presenters. There were some questions listed in my document, but since we have no time and since we are badly behind the time, we are going to wind up the session. And as we are concluding the session, we have to present certificates for the presenters, valuing their presentations and research skills and also their enthusiasm in making the researches. I'm going to start this certificate presentation, and I would like to invite Venerable Professor Morogallagama Uparatana Thero to present the certificate for the presenters. The first certificate goes to the first presenter who made the presentations under the topic, under the Pali topic, Venerable Sundara Lankara Thero. The next certificate goes to Dr. Mr. Chandana Abeyawardana,